Peterman. It is February 2nd and it is 4 o'clock in the afternoon, and today I'm going to be performing tracheostomy care, suctioning, and as well as nasal and oral suctioning. Okay, so we're going to go ahead and start off with the tracheostomy suctioning. I have raised my bed to a working height, washed my hands, double checked that this is my patient, and provided privacy as well, and I've also checked my physician's orders. So I have my patient hyperoxygenating right now, and we have already established a communication method that we're going to have for whenever, in case he would need to tell me that he can't breathe or something. All right, we're going to go up on suction. We're going to go between 80 and 120. I'm going to make sure that this is working, and it is. All right, so now I think we have everything. We can go ahead and begin. Okay, so this is going to become my dirty hand now. I'm going to make sure one more time that our suctioning is working. We're going to connect. All right, then we're going to test. Clear the line, and it's working just fine. All right, so the next thing we're going to do is we're going to take the oxygen away from our patient for just a second. All right, I'm going to warn him what we're going to be doing. Okay, I'm going to enter your trach. We're going to go down, make sure not to suction until you're coming out. All right. Don't press past resistance once you feel it. He's coughing a little bit, so we're going to come out twirling and suctioning intermittently. Okay. All right. And then we're going to do that another 2 to 3 times, depending on if the patient needs it or not. All right. So I'm going to go ahead and set this back here because we're going to be using it again here in a little bit. If we didn't need to suction the nose, we would discard of that. And I would clear the line. We need to clear the line of any secretions as well. All right, so we're going to get rid of this. All right, now we're going to be performing our tracheostomy care. Open away from me. Gloves are just a little large for me. That's okay. We will make it work. Okay, so now I'm going to go ahead and get the inner cannula. I'm going to take the oxygen away from my patient. All right, we're going to reoxygenate the patient. I'm also gently going to pull this dressing. Oh. We'll wait on that. We'll just do this for right now. All right. So I have my spot in here, my empty spot. I'm going to go ahead, and we're going to say that my facility doesn't make us wash these, so we're just going to go ahead and discard of that. But if we needed to wash it, we would have done half NS, half peroxide. We would have cleaned it. We would have given it, cleaning all throughout, let it dry for just a second and rinse, and then we would go ahead and reinstill it. So we're going to pretend that this is a new one. All right, we're going to take the oxygen away. Insert till we hear a click. Okay. All right. And his tracheostomy ties are very good. They're nice and secure, so I don't think I need any assistance right now. But I went ahead and got rid of the old dressing. And I'm just kind of looking around here, making sure that there's no redness or anything, and there's not, so that's great. So we go ahead and we get our new dressing. Okay. to use one that's not already pre-cut, and this one is. All right, so we would go ahead and undo just one side of the tracheostomy collar while holding this in place. We're going to put this side into place. And then we're going to re-secure it, making sure that there's no breakdown of the skin or anything behind it. All right, and then I'm going to get in front of me. We're going to come over here and undo this side, making sure that there's no skin breakdown as well. And then we're going to place that side of the dressing, all while holding on to the tracheostomy, and then we're going to re-tie over here. Get oxygen back on our patient quickly. Okay, so from there, we're done with our tracheostomy dressing change and care. So we're going to now suction the nares in the mouth. So I'm going to clean my hands, put on some new gloves. Right, and these two procedures are not sterile, so just clean gloves is fine. All right, so we have our tracheostomy suction tube from earlier. Let's make sure, double check that it is on. I'm going to clear that line one more time with our leftover normal saline over here. All right, and we're just going to pick an area and we're going to go that direction. We're going to warn my patient what we're doing. We're going to insert just a little bit. You don't want to go in there too far. And then suction as we come back out. We're going to go in the other side, do the same. Suction on the way out. All right, and we are done with that. All right, now we're going to do oral sectioning. We're going to get our Yankar. All right, we're going to go, avoiding the gag reflex in the teeth and everything, we're going to go back to front, come over here, make sure not to harm the teeth at all. All right, and we do that just as much as the patient needed to. And then since I have normal saline, I'm going to go ahead and just flush my line because we'll probably have to use this one again. All right, and then I would go ahead and document how the patient withstood all 4 of the different procedures. At this time, if the patient had any complications, you would want to go ahead and listen to their lung fields and make sure that everything is okay. Drop their bed down and clean up your area.